Hello, it's Judith here. One of the symptoms that can come with anxiety is, well, a form of depression, or actually quite a severe form of depression in some cases. And it's interesting because you wouldn't expect the two to go together because they're quite different states. When you're very, very anxious, when you're suffering from clinical anxiety, then you are, in a sense, very active in a negative way. So there's an awful lot going on mentally and emotionally, and sometimes physically as well. Whereas with depression, you tend to be very inactive. It's quite hard to often get the motivation or the whatever is needed to actually do stuff, sometimes to the point of not being able to get out of bed in the morning. So you wouldn't expect the two to go together, and what tends to happen is we sort of flip-flop between them. My view being that if you're really, really anxious, sometimes the only way that your mind can deal with it is by throwing you completely in the opposite direction and giving you a rest that way. So how do we deal with that low mood, that feeling of depression, which can come on quite suddenly for no apparent reason, or can be a sort of general low background almost, that gets worse on occasions? Counterintuitively, it makes no logical sense, but then none of this does. The best thing with a low mood is to sit with it. So I teach mindfulness as well, and one of the things that we learn and one of the meditations that we use is just sitting with the physical manifestation of a low mood. So for every emotion, there will be some manifestation in your body, some feeling in your body, some sensation that goes with that emotion. So the easiest example and the nicest one to think about is that sort of fizzy feeling you get when you're really excited, really looking forward to something. But all of the emotions come with some feeling, in sensation in your body. So in the mindful meditation, we would actually just sit with that feeling in the body, observing it and being curious about it, but not trying to get rid of it, not trying to push it away, not trying to avoid it, because if we do that, it tends to fight back and come back. So the video that I have done for low mood stroke depression is my hypnotherapy version of that, where we actually sit with whatever's going on in your body that's related to that feeling of depression. Yeah, so sorry, I was thinking of other things to say, but let's keep this short and sweet. So yes, that's the video for you if you are, alongside other anxiety symptoms, probably getting this low mood that either is with you continually and gets worse at times, or just suddenly appears for no apparent reason. Or you can just try yourself of just sitting somewhere quietly and going through your body and finding out where you feel that in your body and just sitting with it. I found years ago, when I was a teenager, I suffered from migraines, and I found then that it works as well with pain. So when I obviously had painkillers to deal with it, but while I was sort of lying in bed waiting for them to take effect, actually focusing on the pain was the best way to deal with it. Whereas what we want to do is to try and push it away, or think about something else, or pretend it's not there. And that doesn't work. That just makes it worse. But actually just focusing on it is the thing that makes it bearable. until in the case of pain, you know, the medication kicks in. Now, yeah, there is medication for anxiety and for depression, but even with that, and definitely without it, having some other way of coping with that low feeling is vital, I think. So if you're interested in the video, I'll put the link in the comments. Have a look at it. As I say, you can just try the technique for yourself. And if anybody's interested in mindfulness, which is a course, so it's there's not a one-off. We sort of build up to being able to sit with difficult feelings. Then just get in touch with me, either in the comments or direct message. Okay, hope that's been helpful, and see you in the next video. And until then, as always, stay safe and stay well. Bye.